Your ankle and your foot are one of the most commonly injured parts of the body that gives you problems. So first of all, what makes up the ankle? Well, the ankle joint is made up by a couple of bones in your lower leg called the tibia and the fibula. But then the most important bone of the ankle joint is actually what's called your talus. It's a dome-shaped bone that sits in the ankle and the foot itself. And it's what the tibia and the talus come and sit on top of and next to. It's set up so that the talus would move up and down on the tibia, or the tibia would move up and down or forward and backwards. But the problem really comes into the fact that because it's a dome-shaped setup, there's a lot of potential for side-to-side movement to occur. And that's really where the ligaments of your ankle come into play. The ligaments are like a rope. A rope shouldn't stretch, and a ligament should do the same thing. So if I have my tibia on top and my talus in my foot, there should be space in between those two bones, and then the ligament would run along the side, and that ligament should keep those two bones sitting next to each other and not allow the space to increase and not allow the side-to-side motion to occur as well. Then we would have muscles that sit up in our calf or in our lower leg, and all of the muscles that control our foot and our ankle come from our calf. They all run along that line from a tendon, such as your Achilles tendon or your peroneal tendon or something along that lines. But tendons are then the rubber band that attaches a muscle from up high in your calf or in your lower leg that runs down and attaches to a part of the ankle to try to give it some stability as well. So ideal movement for your ankle joint should just be up and down. It should just be forward and backwards motion. It's that up and down motion that occurs when you're walking. You put that foot out in front of you, your heel hits the ground, the foot gets back behind you, your toes push off, and that's what gives you that pointing or what's called plantar flexion motion. Or when you're driving a car and the motion is the up and down on the gas pedal. Ideally, we would have just up and down motion of our ankle. But the problem comes in when we have this side-to-side motion. It's what's called inversion and eversion. So a little bit of inversion and eversion is needed in order for good up and down motion to occur. But inversion and eversion should be limited to about 5 to 10 degrees. And the problem comes into play where we end up with 20 or 15 or 30 degrees worth of actual available inversion and eversion mobility in our ankle. And that's what sets us up for a lot of common ankle and foot problems. We prevent all of those problems from occurring or from getting worse by making sure that the space in the joint stays as open as possible. You do that by making sure that you've got good mobility, especially in that upward direction, what's called dorsiflexion, by trying to limit and make sure that the ankle is as tight as possible in that side-to-side motion so that you don't get side-to-side shifting. And you prevent that by stretching and strengthening. Now, it's very easy to strengthen for the up and down motion, but it's very difficult to strengthen for the side-to-side motion, for that inversion and eversion. And that's really where physical therapy comes in. We can put together a specific program that's made for what you need to do in order to prevent excessive side-to-side motion. Now, if you've actually got an ankle problem, whether it's just global ankle pain, it's some swelling, it's a specific point tenderness, it's an Achilles tendonitis, it's arthritis, whatever it might be, then what we really need to do is evaluate your ankle, figure out what isn't moving properly, where the space isn't staying as open as it should be, where tendons aren't stretching out as much as they should be, and where muscles and ligaments aren't providing the support that they should be. Put together a specific program for you. Any ankle or foot problem can be taken care of, but it gets taken care of by putting a specific program together. So if you're having any ankle or foot problems, if you've had a history of ankle sprains, whether it's 1 or 30, if you've had a history of plantar fasciitis once or 10 times, etc., let the expert physical therapist here at Loudoun Sports Therapy Center figure out what's going on with your ankle and help you to be able to have a good, happy life that allows you to move around without any ankle or foot problems.